MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Welcome to MedBix Webcast. I'm the host, Ramana Raju. Sure, I'm not Albert Einstein, but I'm pretty good. So anyway, that we are, this is what we do Monday to Friday, as I said in the broadcast. The whole world is going through a mental health crisis. A mental health, not a crisis, it's a catastrophe, in fact. So if you ask a policymakers, it is a catastrophe. So not too many policymakers or governments cannot do much. It is a huge problem. So, this is a kind of we think that the doctors who take care of all of us, we think that they are gods and they don't have any other problems. In fact, they are humans and they go through the same struggles as not actually. They found out there are more suicides among the doctors than general population, percentage wise, compared to the percentage. That is a staggering statistics in my view. People who take care of us are going through that thing. We need to pay attention to that, seriously pay attention to that. This is not a first thing that we have for Florence Nightingale, for example, she went through a mental depression, in the history. Then John Catt, John Catt, I think his name is, who discovered the lithium for the bipolar, he went through mental depression. Of course, Sigmund Freud went through depression. So these are all people among the physicists. I have a master's in physics. Among the physicists, lots of them committed suicide. In fact, Boltzmann and Kurt Gödel and those people, they went through serious mental struggles. So except Albert Einstein, every physicist went through mental health crisis. Now the physicians are going through, after this pandemic, it is exacerbated. It has really made it much more worse. So I have a guest. She is a champion, Dr. Katie Cole. She's a champion. She was constantly talking about these healthcare challenges for the physicians. In fact, she is a really advocate for the physician mental health advocacy. She is a true advocate. Let me bring here, welcome, Katie, Dr. Katie Cole. Welcome to the MedBix Webcast.
Hi, thank you so much for having me on your podcast today. I'm honored to be a guest.
Yes, Katie, I tell you, there's so many things going on among physicians, and there's so many mental health struggles. That's why you think that. What are the factors causing that mental health struggles, you think?
Well, gosh, I think it's multifactorial. I think we already had an epidemic of burnout among physicians before COVID-19 pandemic, but since 2020, the percentage of burnout just keeps skyrocketing every year, and the levels of depression and anxiety are also increasing annually. And we could just do a whole podcast discussion just on the factors contributing to all of this. But I really think it starts with healthcare leadership.
Yeah. So your background is, you're a physician, you're a doctor, and you did it.
Yep, I'm an osteopathic physician. I did a psychiatry residency, and then I've done additional training in functional medicine and holistic medicine as well.
So as you said that the leadership, they don't train in the medical schools. The leadership, there is nothing much you cannot get anywhere in the medical schools or in the real life. There is no special programs how to be a leader and solve these problems. You're solving everybody else's problem, not among your own problems.
Mm-hmm. Well, that's a really good point. As physicians, we don't really get any training in leadership development. And in doing a psych residency, I was lucky because I was chief resident. So we did have a mentorship program for chief residency. So I had a little bit of leadership training, but it wasn't encouraged past residency. So when I became attending, it was like, you're a leader now. And I just had to kind of figure things out on my own, and I had no formal mentoring or leadership training after that point.
Yeah. So I watched a little bit of your program with Dr. Paul Dechant. You were saying that's a very excellent program. In fact, I enjoyed it.
Oh, thank
So
you.
yeah. So what impressed me was that is a human factors they're talking about. One of the things that particularly that is outside of things that really fascinated me was conflicting personal conflict with the hospital administration, with administrators. That's a very interesting concept. You brought it up. What do you think of what is your opinion on that?
Oh, you hit the nail on the head with that one. Boy, I mean, that's one of the top 6 drivers of burnout actually is a misalignment in values within a healthcare employee or physician and the healthcare administration hospital organization. And a lot of times hospitals have a set of values, but it's not integrated into the fabric of the healthcare organization. And so, everyone has their own interpretation of what the hospital's values are. And it causes a lot of problem because there's miscommunication and every leader is showing up differently and behaving differently depending on how they interpret the value of the healthcare system. And then you've got the whole capitalism and the money making and profitability aspect, and doctors are just trying to help patients, right? So already there's a mismatch and misalignment in values.
So you said there are other factors. So just give me for a few other factors. What are the causing physician burnout? Everybody knows, but you can repeat that again.
I'm kind of giggling because it's so overwhelming, and I was looking at a new report today that it just came out from Medscape. It's their annual survey, and it shows that 91% of physicians that they surveyed, which is almost 9,000, reported symptoms of depression. 91%.
Oh
I'm
my
still
God.
blown away, and I'm still processing this data today and trying to wrap my head around it. I mean, so it definitely things are escalating for us. I think one of the top drivers of burnout for physicians is work overload, and from a human factor ergonomic standpoint, too much of a cognitive overload. So, there's too much administrative burden. Doctors are acting as administrative assistants. They're doing their own typing. They're spending more and more time on the electronic medical record and less time with patients face to face. And that's what brings doctors pleasure, and reward. And that's what, at the end of the day, we feel good about what we did because we were with our patients. But at the end of the day, if a majority of the time, which we know about 70% of our time is spent on the electronic medical record, there's not much value in that. So I think that's one of the major factors driving burnout.
I wanted to just repeat that what you said. There is 91% of the Medscape reported, 91% of the physicians are going through a mental health struggle. That's what you said?
Yep. So it was.
That is a staggering statistics.
Oh, no. It is. So 67% of all physicians surveyed said 67% had symptoms of mild depression and 24% reported actual severe clinical depression. So that's a total of 91% of physicians reporting some symptoms of depression.
We have to, that is unbelievable. That is
I
unbelievable.
can feel it, but to actually get that data firsthand, it is mind-boggling. And this is a call to action. We have solutions to fix our healthcare system and culture of medicine and create a healthier work environment. We need to start doing it now.
It's a fundamental problem, Katie. Infrastructure problem. The fundamental problems are there in the healthcare system. It's a deeply flawed. The starting point, the original point itself, is a wrong one. That's we need to go back and we need a strong leaders. That's one of the doctors from the Kaiser Permanente CMO. He talks about it. Robert Pearl. He talks about
Oh,
yeah.
everything okay?
Yeah. Okay.
Okay, good.
What happened, son?
I think
That is your side or my side?
I think I'm okay on my end.
Okay. I don't know where let me see that maybe something is coming.
Technical difficulties,
Oh yeah, it's okay now. It's okay.
Okay,
So
good.
it's just internet problem probably. So there was let me bring this slide back to you. one
Okay.
slide that you posted it. That's I wanted to bring it. That yeah, that is, let me. That is that's a human
Oh,
factor slide.
yes.
I was very impressed with it. It's so complex. It is really you need a multifaceted issues that we need to solve that problem. You just have well demonstrated this all these socioeconomic, socio-cultural, and then and perception wise. Can you go through one or two things on this one, and physical, of course.
Well, I mean, we really like the model of human factor ergonomics because it really speaks to. I think we have the data to show how when we are not optimizing human performance based on our ability or even our workload and our cognitive load, when we don't have the basic resources available to navigate our day successfully, we're set up for failure. And then we're set up for burnout, and we're also set up for depression and anxiety at work. And so one of the things we talk a lot about in healthcare, changing healthcare on the front line, is addressing the cognitive load piece. And there are quite a few solutions that we're doing to try to address that nationwide. One being really decreasing the electronic medical record burden and using technology to come in to help dictate for physicians and increase face-to-face time with patients and less time on the computer.
I was talking with a physician yesterday. He was telling the same thing. I used to place doctors. One of the doctors, a friend of mine, is over 60 years old. He said that when we are installing a next gen system, and then he was saying that I'm scared to go into the exam room. I don't know what button I'm going to press it wrong. I have never been scared this much. Frightened by these computer buttons. I don't know whether I press the wrong button, right button. I get into trouble. He is worried about not the patient. He's worried about the electronic medical records, what buttons he is pressing.
No, I know. I mean, it's mind-boggling, right? As a doctor, your worst fear is actually the computer loading properly in the morning and not having a computer shutdown problem. And that's actually part of what they call the shadow work in human factor ergonomics is, we've got what our daily routine is and the amount of work that you can see, but there's also the amount of work that's in the shadows behind the scenes that you can't see that's happening during the day. So, maybe a doctor gets 5 minutes to come in and load up their computer for the day, but the problem is the computer rebooted overnight. They did an upgrade, and now the EMR isn't loading, and now they're already 10 minutes behind because they're waiting for IT to come down. And so it doesn't take much to get the day out of alignment. And that's part of what's contributing to the cognitive load.
Dr. Matthews, I interviewed him. He made a very excellent point about this. What he said was electronic medical records are not liable if they do mistake. Even if they present the wrong data to you, they are not liable. The physician ultimately responsible. He is liable. He will be sued. That is a very strange because this is not the liability. It doesn't touch the electronic medical records. I think that is a legal structure is a problem right there somewhere, right?
Well, absolutely. And I mean, I think that's what adds to some of the anxiety and also the level of burnout during the day is, at the end of the day, we are responsible for our clinical care and doctors carry the burden for that. So
when you go to the hospitals, do you have any centers that you can go to a room that you can peacefully sit down and do some meditation or some kind of instruments there that can calm you down? Are there any things are setting up hospitals now or they don't care, just to do work all the times?
Well, yeah. So I can't remember the name. So there are companies that are creating these, what they call kind of virtual reality booths, which I know you're really familiar with. Yeah. And there are stations where physicians and nurses and frontline healthcare workers, and in fact, all healthcare employees can go to take a break. And it helps with kind of calming down the nervous system. So I know some organizations are implementing those. Other organizations are, creating like maybe a patio outside with plants and an area for people to get fresh air and to take time in between shifts to do that. But I don't think that that's standard practice yet. And I think that's one of the things that we need to change.
Very good. So that's one of the solutions, definitely. The burden of the EMR is definitely a good practical solution. They need to implement something We need
Yeah.
to come back with some solutions about how to reduce that fear and that burden of the EMR, electronic medical records. And the second one is some kind of relaxation techniques that you provide, resiliency training. That is I asked a chat GPT, there's a new artificial intelligence tool. What are
Oh,
the things that it gave me some answers? I'm going to show you at the end. Okay. It's very
okay.
interesting answers it gave.
Yeah.
How you can reduce the stresses of the system for the physicians, particularly for physicians. It is saying there is a serious issue. ChatGPT was saying that is the healthcare, the pressures and the mental health struggles among physicians is really a serious issue. We have to address that as soon as possible. But I'm going to talk about another woman, extraordinary woman. I'm going to present to this one, and you could watch with me that this is let me. Okay, me and Katie are going to watch this. That's what the human factors. There's a lot of struggles going on, and a lot of people don't know this. But this is this is a different story, but it's very related to the all the struggles women go through. She's a professor at Dartmouth. She is at Dartmouth College. She gave a State of the Village report in 1990. If the world were 100 village of 1,000 people, she produced a report. It says that if there will be 5 soldiers, 7 teachers, only 1 doctor, and then 3 refugees, that is the rest of the more general population. That's what she gave the report, and she gave extensive report. She was doing a column in Boston area. She was doing this column every week about the citizen's health, global citizen. She was doing a column, and she did this. It actually inspired several. Now she passed away. I will explain to you who she was, but she inspired several people. One of them is this 100 people organization. She inspired it. I will let you watch that video, and then you
The 100 People Foundation is asking 500 schools from 100 countries to nominate 10,000 people to help us find the 100 people that best represent our world population. We've created a lesson plan that explains how a student can nominate someone they admire from their local community and fill out a community profile that helps us understand where they come from.
This is my schoolhouse. Masaya ako na interview ako, na camera ako. Masaya ako na nakilala ako nila, ma'am, natulungan nila ako. Masaya ako. Lalo na sila, masaya ako. Kasi as in, di ko sa dekalain na ganito, interview na ako, may camera ako. Kasi sa amin, wala.
We are asking the children of the world to introduce us to the people of the world.
I think this project will really open the eyes of a lot of people that we're not alone in in this world, that it'll be good to see how everyone else lives in the other side of the world.
irsi ba kala dori dum dumay din imirga bora kulme te mefo imdu doro din kaban bora im fay bora kulu imete mefo im fay di yanja asibu.
There are, just 1 second, we're going to see. So we're back. If the world were 100 people, how they are distributed, it becomes so more personal if you consider this whole planet is just 100 people, how the distribution of 78 people would have place to shelter, then one would be dying of starvation, 11 would be undernourished, 22 would be overweight, and that is the statistics. If there are only 100 people today, so yeah. So one good thing is, and the whole thing is, if the world were 100 people, 65 would be cell phone users, 47 would active internet users, 95 live in an area with a mobile cellular network. Entire world. That is an absolutely great. That's one positive thing. We did a great job in that one. So there is entire world was. Her name is Donella Meadows. I'm sorry if I say wrong way my pronunciations.
Yeah.
She was born in 1941, and she was a professor of Dartmouth. She has a PhD in biophysics from Harvard. She's a MacArthur Fellow, MIT. She was a computer modeling she was doing at MIT. She was working for a professor. He invented the magnetic tapes, how to store the computer data on magnetic tapes. She was working under him. She traveled across the world. She went to India and Sri Lanka for 1 year with her husband. She was traveling by car in the entire country in 1960s. Amazing woman. She took all the chances. I don't know. People don't do that nowadays. They were so busy. So she got that experience. Spent a year, Turkey, Iran, Afghanistan, Pakistan, India, and Sri Lanka. She traveled for a whole year along with her husband. So what she wrote a book. It's called Thinking in Systems. It's the classic book on systems. Is more than 500,000 copies are sold. This is a fabulous book. The book opened my mind and reshaped the way I think about investing. Forbes wrote that one. She took a complex mathematical equations of physics. She's a physics professor. She took all the equations and made it personal and extremely how you can implement to the professional life. What could be complicated? What are the liability points are? She made it much easier. Though she is a scientist, she did not believe in the reductionism. She thinks that you cannot subdivide all the parts she thinks that the whole is more than the sum of all its parts. That is a very woman with a scientific background telling that's really revealing. Now there is a school of thought in the physics thinking in that direction. Donna Meadows. Now, as you know, healthcare is a very solid triangle, quality three, these iron triangle they call quality, cost, and access. They always say that if you only get 2 out of 3, just pick out of 3, just 2. That is not true. It is actually, you can break the iron triangle. You can get all of them. It is a nonsense. Somebody who is promoting this, business people are telling these healthcare executives, probably healthcare insurance companies are telling you this kind of things. You can achieve all of them at the same time. So this iron triangle can be broken into the next step. So if there is 1,000 people on this planet, the Austria has the highest number of doctors, number 5 for 1,000 population.
Wow.
Then United States has 3, Brazil has a 2. The lowest is Brazil. In the psychotherapist, Norway has a 3, Germany has 2, and Turkey has a point. The United States, 0.6. The United States.
106 therapists for 1,000 people?
Well, yeah,
That's a
the
lot.
0.6 therapists for
Oh,
the
0.6 the United States. Now that makes more sense.
0.6. No, that is. I think that is not didn't come out right. Probably
Yeah.
mixed up
No,
in
I
the
believe it.
PowerPoint.
There's a huge shortage for sure.
Huge shortage of psychotherapists.
Yeah.
That is a. Then in mammograms, access to 1 million for that's for 1 million mammograms. Greece has the highest number, 67. Among all the countries, Greece has a 67 mammograms. For the United States has 63. Poland has the lowest amount, that's 10. The MRIs, for example, these are all the breast cancer. Women's health is depending on those things. In Japan, has a 57 for 1 million. The United States is 34. India has a 20. Mexico has a 2, the lowest amount actually. So this is then quality is a World Health Organization measures the quality on these parameters: effective, safe, people-centered, timely, efficient, integrated. Still 8 million people die every year with a poor quality of healthcare, because that quality is such an important thing that is we have to improve all those 6 factors to improve that. Otherwise 8 million people are dying because of those quality itself. Not about the disease, the poor quality itself. Then next one is quality measures in the United States are a little bit different. They do inpatient and prevention, patient safety, and pediatric care. These are the yardstick measurements in the United States for the quality measures. They took a different yardstick they did. I'm pretty sure we're not doing that great. One support cost measures are support cost about the patient and the cost of resources. These are all two are the cost measures they do in the United States of the measurement units. Doctors in the world is 92 million people in the doctors around the world. Doctors in America is almost 1 million. Nurses in the world is 27 million. Nurses in America is 4 million. Mental health professionals, 400,000. Mental health professionals in USA is 300,000. It's not bad. For that, still with a 0.06 it's still less. You're saying something, Katie?
Well, I was just going to say, it's really kind of scary because in 2021, we lost over 117,000 physicians. So we're down to less than 1 million, and we lost more last year. The final numbers haven't come out, but we're losing almost 10% of all physicians every year in healthcare.
Unbelievable. Yeah,
I know.
This is a really catastrophe in making. Counties with the oldest population in the world are Japan, Italy is the second one, Germany is the third one, and all the way to China. And these are all the countries with the oldest population in the world. So they need more doctors and nurses and all healthcare professionals required. There's a huge demand of services required there in those countries.
Mm-hmm.
The countries with the youngest population in the world, very surprisingly, continent of Africa as the youngest population in the world, not India. I used to think India is getting older now. Is Niger, Mali, Uganda, Somalia. They're going to help us when we get older. So we need to depend on them. Think about taking care of us. Then, so that is I'm going to show a video about healthcare. It is let me show you that video. That 1 second. I'm going to bring that. I'm going to.
I think throughout the world that healthcare should be a baseline of all of our actions as a group. All of the countries together, good healthcare and feeling well should just be a given.
Well, in the rich world, health has improved incredibly.
all of the countries together. Good healthcare and feeling well should just be a given.
Well, in the rich world, health has improved incredibly, whereas in the poor world, the sanitation, the vaccines, the nutrition that we take for granted is not available. And so you have a lot of societies where over 20% of children die before the age of 5.
We need more doctors volunteering their time or even getting them paid by someone to actually go out and take care of people who are suffering because they have a lack of access to the healthcare.
The 3 biggest killers of children are malaria, diarrhea, and respiratory pneumonia. And what happens is the kids get weak, they don't get enough nutrition. So even things we don't think of as a big deal can often kill those children. So if we got vaccines for those, improve the nutrition, some of the birth practices, we can cut down on it. 9 million children died in 2008. Now that's down from 20 million 50 years ago. So big improvement, but it's still too many. And the most magical is a vaccine. You get a few shots when you're young and you're protected from the disease for life. So smallpox killed millions a year. The vaccine eradicated it. Measles killed over 3 million a year. Now that's down below 500,000 because the vaccine, we need to get that to everyone. So we need to invent some new vaccines. We need to distribute them better. That's basically where the magic is. Unfortunately, the percentage of kids going into these areas from rich countries, math, science in general, is going down. It's somewhat a mystery why those professions that are fun, have big opportunities for impact, why the growth in those is so much coming out of China and India. I mean, the total number of engineers in the world, scientists in the world is going up, but it's entirely the Asian growth. So that's another thing that we need to learn about it, but you know, kids are the ones making these choices. What are we doing wrong?
How would we get the youth of America and the world to look at different problems in a certain way that they want to improve on it?
You know, if kids can get out to these poor countries and see it firsthand, you know, that is so worthwhile. It's not easy to do, but the ones who get a chance to come back, talking to others, videoing what their experiences are so that other kids can relate to what they're saying. I think that's part of how we're going to keep awareness going up and therefore keep the focus on these issues.
My dream is to become one of the best infectious disease doctors in the world. We can never completely eradicate all infectious diseases because, as we see now, resistant strains of tuberculosis, for instance, are coming up. And so we can never really get rid of all the diseases, but we want to prevent disease that is currently preventable. And it's through technology that we can achieve this.
It's both invention and delivery that we need to do better on. I think with the internet, with the current generation caring more broadly about what all kids are experiencing, I think there's an opportunity here to build awareness, to get kids to come up with ideas, to donate, to volunteer, and use their voice.
Thank you. Everyone's life is equally important. We should level the playing field. It shouldn't have to deal with money, whether you live or die because of a disease.
Let's see. I can't hear you for some reason.
Yeah. So now I forgot. You know, the reason I put you in the mute is I got to put you in the mute because it echoes all the time. So that's why I put it.
Sure.
But now you don't have to do. At the time when you're playing a video, you have to do that. You know, I forgot to tell you that. That's okay. Now it's done. That's why I put in the background to make it. But anyway, Donna Meadows died in 2001. She's with a cerebral meningitis at the age of 59. She's a truly inspiring leader, scholar, writer, and a teacher. So there is a Donella Meadows project. Is actually, you can go and visit that donellameadows.org. She's a true scientist, true woman who cared for this planet and cared for the people. So there is another woman coming up. She is the one who really cared for other people and other doctors, in fact. That's a Katie Cole. It's Katie. Tell me, what do you think of it?
Well, I mean, that was a very, humbling presentation. And just to think about if we were only 100 people, what our society would look like. And, I don't know how far we've come in healthcare since 1960, to be honest.
Yeah.
Since Dana Meadows was studying, all of the sociology and human behavior and access to care. I don't know how much better we're actually doing as a country right now.
I was thinking exactly the same thing. It's not that different from those days.
It's really not.
It is surprisingly and shockingly surprising.
Absolutely.
It's not shocking anymore. It is just unbelievable.
Yes, I agree.
Katie, you're doing a greatest job. One of the really great job. Actually, you're bringing it is a not talked about subject among physicians. You're bringing that stigma, and actually the stigma is associated with even doctors more because they don't want to even tell anybody they're taking care of everybody. They don't want to say that they're going through a mental health struggles. In fact, you're bringing out there to the public and then this is an important issue that we need to address. Actually, Kamala Harris was addressing recently about that. So what is your podcast and what do you do? How do you promote this your advocacy?
Well, thank you, Ramana. So my podcast is called Hope for Healthcare because at the end of the day, I have hope that we can change our healthcare system. And I have faith that we have the resources and the solutions available. We just need to understand what they are and know how to implement them. So on my podcast, I interview experts around the nation on what they're doing for their healthcare system that's making an impact and decreasing burnout, improving employee engagement.
Thank you. It's a truly, you're doing a great job and truly an honor to talk with you. And you're still, your contributions to the physician community has to be noted. And then thank you so much, Katie. Thank you so much for coming on my show.
Thank you. It's been an honor to be here today. Thank you for interviewing me, and it was a great discussion.
Thank you. Thank you.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it